answering questions. Let's hear first from Professor Low. Friends from the media, people in Hong Kong. 2 days ago, the Chief Executive delivered his 2023 policy address. Today, together with the Health Bureau, Department of Health, as well as Hospital Authority, I will give you more details on our initiatives. The topic of this policy address is a vibrant economy for a caring community. We all know that health is a very important element to have happiness. So there has been a lot of coverage in the policy address to enhance the health of Hong Kong people so that Hong Kong people will be well cared for and they will be happy. If we can use innovation in healthcare, there will be development of industry, which in turn will benefit our economy. Let me give you some more information. There are 10 major items in the initiatives in these areas. It includes a health and medical innovation hub, cross-boundary collaboration, manpower, electronic health record, dental health, primary health care, mental health, Chinese medicine, public-private healthcare services, as well as fighting against communicable disease. I will go into details of each item shortly. There are different complexities under the different topics, so I might spend some more time on certain topics that are more complex than others. First of all, I would like to start with Health and Medical Innovation Hub. We have high-quality healthcare services in Hong Kong and a very efficient public healthcare system. Healthcare in Hong Kong is always at a leading position, not a follower. If we have innovation in healthcare, Hong Kong people will greatly benefit from it. In the 14th Five-Year National Plan, Hong Kong is positioned as an innovation and technology center. Innovation in healthcare and medicine can bring the benefits of having efficient medicine in Hong Kong so that Hong Kong people can benefit. We can use the most advanced medicine and we can have research and development in new medicine, which in turn, if we can commercialize these R&D products, it will help our economy. We need to make sure that the product of research and development can be used in clinical trials so that there can be an industrial development in this regard. And these are the important topics in the policy address. If we are going to have innovation, we need to do more. First of all, we have to be more active and we have to ensure efficiency when it comes to registration and accreditation in medicine and medical devices. We have to become an internationally recognized regulatory authority for drugs and medical devices. We have to put in place a new system for registration of drugs and medical devices. Starting from the 1st of November, we will put in place a new 1+ mechanism to expedite the approval of new drugs. We need to set up a regulatory authority. We will set up a preparatory office for CMPR, Hong Kong Center for Medical Products Registration. We also need to accede to an international organization named ICH, that is International Council for Harmonization of Technical Requirements for Pharmaceuticals for Human Use. I will defer to my colleague for more details later, Dr. Ronald Lam. Before I do that, I will give you more information on another topic. If we are to accede to the ICH, we need to go through a process. We have to put in place a regulatory regime for medical devices and drugs. We have to meet national requirements and standards. There are 6 steps. Currently, we use secondary evaluation. It's just announced that we are going to use the new 1+ mechanism. It will be effective on the 1st of November. In other words, starting from that day, if a drug is only covered by a certificate of one regulatory authority, as long as there is compliance with local registration of clinical use, then they can be evaluated. We want to join as an observer to the ICU. We have already made an application. We've got the support of the National Administration of Drugs. The next step is to set up the preparatory office for CMPR. Recommendations will be made, and then we will set up our own center for registration. At that time, we will decide when we will formally adopt primary evaluation approach. That means we don't need the approval of other regulatory authorities. We can make use of our own data, clinical data, for the approval. In the end, we aim to become a member of ICH. If we do that, that means we are internationally recognized. Drugs and devices registered in Hong Kong will be recognized around the world. If we are to become a member of the ICH, we have to build up clinical data over quite some time. We think that it will take 8 to 10 years. But in the meantime, we can still proceed with primary evaluation. We don't have to wait till we become a member of ICH before we have primary evaluation. We need to first accumulate experience under primary evaluation before we can apply to become a member of the ICH. Shortly after, Director of Health Dr. Lam will give you more information. Apart from acceding to ICH, having a regulatory authority for medical devices and drugs, we need local clinical data that meets our requirements, because we need high-quality, objective assessments. That's why we need clinical data, and that is based on empirical trial. We need to do 2 things. First is to set up a Greater Bay Area GBA International Clinical Trial Institute. It will be set up in the He Park, in the He or River Loop Park. There are 2 zones. We can leverage on the advantage of clinical trial in the GBA. Hong Kong has a very high standard when it comes to clinical trial, and the GBA can provide a large quantity of data and trials. The cooperation zone will provide us with favorable conditions for us to proceed so that we can obtain recognition from not just our country but from international authorities as well. So this institute will be set up in the Hetao Shenzhen Hong Kong Science and Technology Innovation Cooperation Zone. We will discuss with the mainland authorities on collaborated development. We hope that there will be seamless flow of talent in this zone. Samples and data will flow freely in the zone as well. So we will be able to have a uniform development. We have sample banks, labs in the Hong Kong and Shenzhen parks, and we will make use of it for drugs to enter the international market and the domestic market of the mainland. We also have to promote clinical research and trials under the Hospital Authority, HA. We will set up under the HA a cluster clinical research and support office. We encourage teams to actively participate in clinical trial and research. We will expedite the procedure and flow of various processes, especially the ethics review. We will also strengthen the data sharing mechanism. Under the HA, there is a robust system linked with 43 institutions and organizations. If we can make use of this system and enable data interchange, it will give us strength. In addition to that, we need collaboration within the GBA. More and more people travel across the border. They go to the GBA for leisure or for work. So cross-boundary medical collaboration is very important. We have 4 tasks to do. Leveraging on the elderly healthcare voucher scheme in 2024, we will launch a pilot scheme for the use of elderly healthcare voucher in the GBA. We would also like to make more use of healthcare services in the GBA, so we will adopt a strategic procurement approach to enable the use of services in quality healthcare institutes, especially those in Shenzhen, to help shorten waiting time for services in Hong Kong. And we've also leveraged our experience in the GBA Talent Exchange program. We want to enhance talent exchange and training. The last area is cross-boundary ambulance service. Previously, when someone is transported by ambulance, there needs to be a change at the border. We want to have a seamless transition so the patients don't have to switch to another ambulance. I would like to give you more information about the healthcare elderly healthcare voucher GBA pilot scheme. The Chief Executive mentioned that there are a lot of elderly Hong Kong residents living in the GBA. There are GBA cities with a lot of Hong Kong residents. We will select institutions in these cities. We look at their experience, their track record, and we will also consider whether they have experience and knowledge about the use of healthcare voucher. So apart from Hong Kong University Shenzhen Hospital, we will consider other healthcare institutions, say for example grade 3 class A hospitals in the GBA. Next, I move on to increasing manpower supply. Well, we have drawn reference from the Hospital Authority Healthcare Talent Visiting Program, and the warm response we have received under this program. We will continue to do some work. We will propose legislative amendments to have more non-locally trained dentists and nurses to come to work in Hong Kong. In addition, we will explore the possibility of allowing more supplementary medical professions, say for example, occupational therapists and other allied health professionals to work in Hong Kong to alleviate manpower shortage in Hong Kong. Next, I will defer to Mr. Thomas Chan, the Permanent Secretary, on e-healthcare record and dental health initiatives in the policy address. Thomas. Development of electronic health record is an important part of the use of technology and data. The e-health is a sharing platform territory-wide developed in 2009. It formally operated in 2016, allowing members of the public to authorize service providers in both public and private sectors to access their records. So far, as of October this year, we have 5.8 million people registered, accounting for about 80% of our population. The app itself has about 3.1 million downloads, and the average monthly access stands over 180,000. On the basis of the massive user base, we will launch eHealth Plus 5-year plan. Our goal is to have an integrated healthcare information infrastructure covering data, interchange, service provision, and mobile management. This will also enable cross-boundary service collaboration and to better support primary healthcare development. Under the eHealth Plus, there will be full connection of service providers between the public and the private sector. Participating members of the public will have their own personalized account. This enables them to have access to their health record, upload their record, manage healthcare services, and to monitor their health condition, as well as to have healthcare records accessible across the border. First of all, we will have an integrated healthcare record. We will amend the electronic health record sharing system ordinance to require service providers to deposit important information onto the eHealth Plus so that members of the public can have full access of the information in the account. We will also launch the portable cross-boundary eHealth record function so that members of the public can have access to their record across the border when they seek healthcare services in the GBA. The second area is to have an integrated treatment flow. eHealth record will become a digital platform that is an integrated system with different functions. It's not just electronic healthcare record system. It also allows members of the public to receive healthcare services at different service points, and there will also be functions such as making appointments, registration, referral, etc. We will also, on a pilot basis, set up electronic drug record for those staying in RCHEs. This will help these residential homes in the dispensing of drugs to residents. Thirdly, it will act as a health tool. It enables members of the public to monitor their own health, and we will also launch various activities and promotions to get the public to better manage their own health. This will also be an integrated data platform. The system itself will be enhanced as a secure and accurate cloud-based system. It will better assist research of healthcare policy formulation and innovation. I now move on to dental health, oral health. In the policy address last year, there was the announcement of the setting of a working group, oral health at oral dental health. They've been working for 1 year. They've been giving recommendations to the government. The working group is of the view that oral health should dovetail with the primary healthcare blueprint and promote prevention of dental problems. The working group has made recommendations in 4 areas. First, to dovetail with the primary healthcare blueprint, emphasizing on prevention of dental problems. There will be different primary dental services for different age groups. The second area of work is to put in place targeted services for underprivileged groups. The third area of work is to review manpower resources and training arrangements. This will tie in with development needs of dental health care. We will allow ancillary dental health practitioners to play a bigger role and to have to conduct a simple treatment with the guidance of dentists. The fourth area is to review service delivery mode and arrangements, as well as the use of electronic records. Based on the preliminary recommendations of the working group, we will launch the following initiatives within the coming 2 years. Within 2025, we will launch the primary dental co-care pilot scheme for adolescents. This will dovetail with the primary school dental services to subsidize adolescents between the age of 13 and 17 to use private dental services for checking. Within 2024, we will enhance services by the DOH to PWDs and those with special needs. Our goal is to provide additional 900 places. That is at least two-folds of existing places. In the third quarter of next year, we will enhance our special dental services under the dental healthcare program. And in the third quarter of 2024, as I said, we will enhance the dental service program under the CCF, the Community Care Fund, so that eligible elderly citizens will receive additional services.
Thank you, Mr. Thomas Chen, our PS. Coming next, Dr. Libby Lee and the Secretary for Health will explain to you all in the areas of primary health care, mental health, and other areas. Thank you, Secretary. Primary health care is pivotal to any medical system. However, the development of primary health care in Hong Kong is still at its early stage. By the end of last year, we have disclosed the primary healthcare blueprint and to set out the roadmap and the key elements for the development of primary healthcare development in Hong Kong. Through different projects, we have established the system, infrastructure, human resources, tools, as well as the awareness and culture necessary to encourage citizens to make use of the services. In next month, that is November, we will roll out the co-care pilot scheme for chronic diseases. We are going to arouse awareness on the importance of prevention. We will also encourage them to become responsible for their own health. And we also need the support from the industry. The program called Family Doctor for All has already been rolled out. At this stage, over 300 family doctors have already been registered. We believe that these several hundreds of family doctors will be sufficient to cater for the needs of the general citizens as we are at the early stage of the rolling out of the scheme. The co-care pilot scheme for chronic disease also requires an effective and comprehensive electronic platform so that the citizens will be able to make use of the medical vouchers and the doctors will be able to look up the medical record. Therefore, just now, PS for Health has explained to you all about the personalized health account. And in order to encourage the general public to put more emphasis on prevention and to treat the disease at an early stage, by the mid of next month, we will also roll out the elderly healthcare voucher scheme. And there will be a pilot reward program for them. As long as they are making use of $1,000 of medical voucher in specific primary healthcare system, there will be a $500 of voucher rewarded to them. In year 2024, we are also going to establish the primary healthcare department in order to enhance our coordination so that there will be quality primary healthcare for all. Mental health has always been a concerned issue of the general public in Hong Kong, and our principle is always putting importance and emphasis on early treatment. There will be 3 pilot center in the district health center. By working together with the community institutions, we are going to train up some supplementary medical professionals so that they can follow up the mild to mid or to medium cases so that there will be timely intervention, treatment, and rehabilitation services. For severe cases, according to primary health care mechanism, we can also make referral. We will disclose more details at the later stage. It also come into our attention that because of the barrier of culture and language, the ethnic minority do require some special support services. We are in the course of discussing with NGO so that there will be a center for mental support and counseling for the ethnic minority. The counselors will support and offer counseling to the ethnic minorities in their own mother language. We are also going to set up a mental health support hotline as a first stop for the public to seek help. We will also offer some timely support as well as referral services. As for Chinese medicine is a special feature in the strength of Hong Kong medical system. We have to make good use of our unique position so that we can collaborate with the country of our country and the international world so that we can bring in and go out. In 2025, the Chinese medical hospital will be in operation. At the moment, we are in full force of the preparation work. Next year, there will be also a strategic collaboration mechanism with a mainland Chinese medicine hospital. Right next to the Chinese medical hospital, there will also be a government Chinese medicine testing institute. At the moment, the testing institute is located in Science Park, Hong Kong. By then, it will be relocated. And the new government testing institute will be in operation at stages since 2025. We are also establishing the Chinese medicine standards with GBA as well as the international sector. Next year, we are going to build up a digital Chinese medicine platform so that all the data, including the plants, Chinese herbs, the prepared drug in pieces, microsections, as well as chemical and DNA data will be accessible for the public. The general public and the industry will be able to access it for testing and for education. It will be also serving the R&D personnel. The Chinese medicine development blueprint will be formally rolled out as the commissioner is in position. We plan that it will be rolling out in 2025. Coming next, I would like to invite Dr. Tony Ko, Chief Executive of the Hospital Authority, to explain to you about the improvement of public medical services. Thank you. I'm going to share with you our efforts in 4 areas. First of all, to enhance our special clinic services and also the accreditation program of our clinics. Let's talk about the special outpatient clinic. Last year, we have set up some objectives and we have put a lot of effort into improving this area. Last year, we hope that 75% of patients will complete the whole procedures from registration to diagnosis in 60 minutes and to complete from registration to medication in 120 minutes. According to our statistics, 83% of patients are able to meet with the doctor within 60 minutes. 80% of patients will be able to complete the whole procedures from registration to medication within 120 minutes. There are also a lot of other programs, including appointments through apps and also drug delivery. Another objective last year is to shorten the waiting time of the stable cases of the medicine department. According to our statistics, we can see that the waiting time has been shortened from 120 weeks to the latest data, that is 90 weeks, so the objective is largely achieved. We will continue to improve our services. Our objective this year is to put focus on the other 2 specialties, including the ENT as well as the orthopedics and traumatology specialties. Together with the aging of population, demand for these 2 specialties continue to increase. We hope that we will be able to shorten the waiting time by 10% for ENT and orthopedics. Maybe you will ask, why are we setting out our objectives at 20% and only 10% this year? If you refer to the chart here, although our major focus is to shorten the waiting time of the medicine specialty last year, but for the other specialties, continue to progress in order to shorten the waiting time. Therefore, such procedures has already been in place, and the waiting time of these 2 specialties have already been shortened. This year, in light of the increase of demand, we hope that we can increase the resources there in order to further improve. Therefore, we believe that the shortening of waiting time by 10% is reasonable. This year, at Queen Mary Hospital, we are also going to establish the first chest pain center in Hong Kong. For many years, because of the progress in the cardiology as well as its services and techniques, the death rate of acute heart disease has been stably reducing. As you can see, the death rate continue to improve in the past 20 years. But we seem to have encountered a bottleneck. That is, we are unable to further decrease the death rate. By establishing this chest pain center, we hope that we could make further progress. As you can see, normally when the patient visits the hospital is because they suffer from chest pain, so there has to be different testing and they need to go through ECG, X-ray and blood test. They also have to be in touch with different specialties and professionals for further services. Then they would be able to achieve the treatment of angioplasty services. hope that through these integrated services, we can focus our resources on the acute cases. More importantly, we want to establish a green corridor for the chest pain patients so that we can streamline the treatment procedures, and with the introduction of information technology, we will offer a one-stop services for these patients in order to improve our treatment procedures and to shorten the diagnosis time. Our latest target is that to shorten the time from registration to the wiring time to be within 90 minutes. Most importantly, our ultimate target is to further reduce the death rate so that more citizens can be benefited.
Something that we will launch this year is to set up the first ever breast milk bank. We will set one up in the pediatric hospital to assist babies that are born prematurely. As you know that breast milk is rich in nutrients. For preterm babies or babies with special conditions, that is even more important. According to overseas experience, we learned that breast milk banks have been set up. Literature told us that it will also be conducive to the prevention of certain serious illnesses, say for example late onset sepsis and necrotizing enterocolitis. And this will reduce hospitalization of preterm babies. We hope that every year we will be able to collect 600 to 550 liters of breast milk every year to benefit 450 to 600 preterm babies. In the development of accreditation of hospitals, we will join a national accreditation of hospitals, that is the hospital accreditation program of our country, to enhance our standards that covers management, patient safety, drug safety, clinical pathways, and infection control. This will also help us to better connect with GBA hospitals. A lot of Hong Kong people work or live in the GBA and they receive healthcare services there. So accreditation and connection is very important. We understand that we have to enhance communication and support to our frontline staff. We want to ensure that accreditation will not affect clinical work of our staff. We aim to maintain high-quality service, so we will enhance communication and support with our staff. We will put in place special programs. At the same time, we will enhance our coordination capabilities in our headquarters. We have set up an electronic platform and a data bank. Information on exchanges, operation can be handled through this data bank electronically. This will greatly reduce paperwork. We'll also make use of innovation, information and technology to reduce repetitive work. We'll also allocate additional resources to assist frontline staff with their work so that they can be free to focus on clinical duties. This will also help reduce repetitive work. So we'll make use of electronic platform, information technology to assist us. Thank you. Lastly, we will hear from Dr. Ronald Lam, Director of Health, on the government's work in fighting communicable diseases. And he will also give us more information on the 1+ mechanism and the regulatory and approval regime, as well as the setting up of the CMPR and accession to ICH. Dr. Lam. Thank you. We have successfully fought off COVID-19, but we should not be complacent. We should always have a sense of crisis and make preparations accordingly. I thank the Hong Kong Jockey Club for their funding. The Health Bureau, the Center for Health Protection, and the Department of Health will enhance collaboration in our capabilities. The first area is to enhance coordination with mainland authorities. There are 3 elements. First, we have to enhance our analytical capability to more accurately assess the development of epidemic situations. We also need to regularize surveillance and monitoring of our environment. Currently, we have the sewage surveillance program. With additional funding, we will consider extending these surveillance programs to other communicable diseases. The aim is to have early identification of risks. The third part is to set up a data sharing system across the border to enhance our joint effort in prevention and control of communicable diseases. We will need to set up an integrated communicable disease system to track relevant information so that we can make use of this control system to enhance our capability and swiftly tackle newly emerged communicable diseases. And the second element is to enhance infection control of certain groups, say for example, residential care homes for persons with disabilities, elderlies, as well as schools. To help them make better preparations, we will devote resources to enhance the supplies and device equipment required to fight communicable diseases. We also liaise with recognized training institutions to enhance training. The third area is to enhance our capability on research on communicable diseases. There will be dedicated funds set up. We will also draw reference from guidelines and information of the World Health Organization to enhance our research capabilities. So that's our work in fight against communicable diseases. Just now, the Secretary has given you some information about our path to become a member of the ICH. I will give you detailed information.
First of all, well, since many have mentioned, the first item that I would like to touch upon is the 1+ mechanism. For the NCEs, that is to treat the severe disease, we will establish the 1+ mechanism for NCEs. As long as they meet certain requirements, the applicants can file for registration. By 1, we mean that the applicant only need to file 1 set of clinical tests by the recognized drug regulatory authority. Second, it has to fulfill the requirement of local clinical data, and its dosage, its applicable scope also needs to be approved by local experts. After submitting relevant scientific evidence and information, we will seek advice from the expert consultation group. There will be a professional and robust evaluation. When we receive the evaluation recommendation, we will hand it over to the authority for formal approval. The evaluation process will be expedited, and we can also have an evaluation based upon evidence. We can ensure that all these NCEs will have assurance in terms of quality and efficacy. As we announced in the PC last year, it will be effective by the 11th of November this year. On the designated website, including the website of pharmacy and poisons industry, related information have been disclosed. We also sent letters to the Association of Pharmacies, the certificate holders, and all other stakeholders to explain to them details of this 1+ mechanism. We believe that as we successfully roll out this 1+ mechanism, we can attract a lot of R&D of drugs as well as clinical trial tests in Hong Kong, so that there will be more top quality medicine to be used in Hong Kong. Second, we are also in preparation of establishing the CMPR in Hong Kong, that is Center for Medical Products Regulation. The establishment of CMPR can help us strengthen and speed up the surveillance and approval of medication and medical products, including Western and Chinese medicines. Since we are putting all of them under one single center, we are following the examples of the international world. We believe that CMPR can take the leverage of what we are practicing already and to bring even greater synergies. We can also optimize resources allocation and to maintain our professionalism. We will be able to progress the improvement of medicines and medical products, so that the development of these two sectors will continue to prosper. CMPR can expedite the innovation of medical products. We believe that next year, we will first establish a preparatory office for CMPR. The office will look into the mechanisms, and they are also going to set out the roadmap of CMPR. As mentioned, the third part is to become a member of ICH. By doing so, we can continue to improve the drug regulation and accreditation standards in Hong Kong to make sure that we can align our standards with the international standards and to become a internationally recognized drug authority. So apart from becoming CMRP, we are also supported by the National Medical Product Administration to become a member of ICH. We are going to prepare ourselves into becoming a member. This June, we have already filed our application to ICH in the name of China Hong Kong. And in November, there will be a member assembly at ICH. At the assembly, we will be able to introduce the development of Hong Kong so that we can become an official observer. After becoming the observer of ICH, our next step is to promote the regulatory of ICH as our standards in Hong Kong, and at the end, we hope to become a member of ICH. The membership of ICH will show the international world that the CMPR as well as our industry will target at the highest standard of the drug and medical products industry. That's all I would like to explain. Thank you. This is the end of the policy briefing. Thank you, Dr. Law and all the other officials. Coming next is the Q&A section. Friends of the media, please use our microphone and please restrain yourself to not more than 2 questions and to tell us your organization. From Ming Pao. I would like to ask about the registration system, because there have been counselors who are promoting the Macau model and the use of national medicine. Why don't we just follow the National Medical Products Administration? Why do we have to come up with our own 1+ mechanism? As you mentioned, you want to promote the capability of drug approval in Hong Kong. So what are the specifics? Will there be our own standards to ensure the quality? As we become a stand-alone authority, will we be operating independent of the government? Second, about manpower. Last year, you have mentioned that there will be a mandatory servicing period of the non-local medical doctors. Why is it no longer existent? Is it because of the opposition from the doctors? Concerning drug approval, we do understand that Hong Kong has our strengths in R&D. Hong Kong is also a connector between China and the overseas country. We hope that we can establish an internationally recognized drug approval authority. Therefore, we will not solely follow the standards of the National Medical Product Administration. To become an internationally recognized drug approval authority, we have to come up with our own approval procedures regarding clinical trials. In light of our current developments in GBA, we believe that this is a golden opportunity to us. Just now, you have asked a good question. If you look at the patients' number, our market, as well as the quantity of our clinical tests, we doubt if we can truly come up with a 1+ mechanism in order to attract international pharmaceutical companies to Hong Kong for R&D. However, the development of GBA is a good opportunity for Hong Kong. We have to make good use of our own strengths and to collaborate with GBA. Because of that, we propose that at He Tao Zone, we have to establish our International Clinical Testing Institute. We have the strength of talents, and the GBA have the quantity of patients as well as a vast market. We hope that by joining forces, we will conduct clinical tests together, so that our tests will be of high efficiency and standard. If Hong Kong can establish our own evaluation process, well, since we already have the policy of the connection between Hong Kong and Macau in terms of drugs, there are drugs and medical devices who are already approved in Hong Kong that can be immediately used in the GBA. So this is an opportune hour for Hong Kong. Our development have to tap into the potentials of GBA as well as the advantages of one country, two systems. Well, because of the two systems, we will not operate in the model of Macau. And we will not just conduct all the evaluation by our own. The mechanism that we have is 1+. So apart from the evaluation in Hong Kong, we will have what we call plus. That means the evaluation of our own expert committee, so that we can move towards the direction of primary evaluation. The new registration system is targeted at the whole world. Any pharmaceutical company in the world or medical devices company, if they are to register for their own drugs or medical devices, they have to first apply for quote-unquote one, that is the world-recognized regulatory authority. We will accept those regulations.
When it comes to manpower, we have different approaches. We focus on training, and we also consider getting talents from outside Hong Kong. As I mentioned, that Hong Kong graduates of medical schools will work in public hospitals for 1 year as an intern. About 90% of these students will go through specialist training of 6 years in public hospitals. When these candidates finish their training, we would like them to continue to work in the public sector. When it comes to legislating for the service period in the public sector, we don't just look at doctors. We also consider nurses, dentists, and other professionals. We hope that using existing initiatives, we will be able to achieve our goal without having to resort to legislation to require them to work in the public sector for a certain period of time. In terms of the future Hong Kong Center for medical product registration, I'll defer to Dr. Lam. Regarding research and development of pharmaceutical products, it takes a very long time, and we need support from different sectors. That's why we need to first set up a preparatory office to give us time to rationalize allocation of manpower and resources before we formally set up the center. We need an interdisciplinary collaboration because when it comes to research and development of new drugs, it goes through a certain process. First is the exploration and development. When it comes, effective elements will have to be identified from chemical substance, and then there will be non-clinical trial. That means they have to identify absorption of these substance by a living body, and that involves a trial on animals, and then there will be clinical trial. After that, there will be registration. We need regulation on the individual process. There will be assessments on toxicology, chemistry, and epidemiology. So first, we need to set up a 1+ mechanism in our preparation. We will train manpower, we will engage experts to make preparations for primary evaluation, and we will learn what we need to do more in order to achieve that. Having accumulated experience, we need to consider the operation mode of the center. We'll draw reference from overseas experience. As I said, when it comes to regulation of pharmaceutical products, it involves various segments, different process, and expertise. For a lot of other jurisdictions, regulation and approval of medicine and medical devices is done by a standalone body. We think that we will set up an independent body that is related to the government, with the government taking the lead. It is independent in the sense of their expertise. The reporter mentioned about competition. I think it's not a matter of competition. The ultimate goal of setting up the center is to become an internationally recognized regulatory authority so that we can have the authority to approve drugs and development of drugs, especially those related to life-threatening or severely debilitating diseases. They can first come to Hong Kong to apply for registration. Hong Kong patients will have better choices, and they will have effective drugs for their treatments. And we need to exercise care in the gatekeeping process. We have the 1+ mechanism. That means apart from one regulatory authority, we also need the submission of information that they have met local requirements. On top of that, it has to be assessed by experts. The next stage is to have expert assessment by our expert panel before they can successfully register. The process itself will be expedited, and the regulatory regime is as vigorous as those in other regulatory regimes. With the experience accumulated under the 1+ mechanism, then we can expand our capability to scrutinizing crude data, say for example, chemical analysis, lab results, etc. The lady in blue in the third row. I'm from TVB. I'd like to ask about mental health. Are there measures targeting those who have yet to see a doctor, those that are hidden in the community? The care team, healthcare institutions, medical training institutions, will they be involved in the referral of cases? Will these cases be more speedily referred? What about manpower? Would you consider manpower from other places or the GBA? I would like to ask about the assessment. What about how do members of the public participate? What are you going to do with stigmatization? Regarding hidden cases or patients that are reluctant to seek medical health, we follow the principle of primary health care. We have collaboration with district care teams. These care teams have better reach within the community. They can help in following up in certain cases. Primary health care is very important because they provide first-tier service to the community. Well, we don't want to label anyone. We just want to identify those who are in need as soon as possible. If someone thinks they need help, they can go to any district health centers. There will be a mental assessment done. Under the pilot scheme, the assessment will be in greater detail, and the patients will receive assistance. There is a hotline available, and there will be referral and support services. What we need to do is that those who are in need will have easy access of support and services they need. Well, if you go to a psychiatrist or a specialist, well, there is a referral service to enhance coverage. On manpower, we want to make use of the pilot scheme to enhance training for our ancillary practitioners, and at the same time to help those who are in need to have easy access. There will also be referral services. We want to enhance manpower supply to increase support to the general public.
The gentleman in the third row. Professor, I'm from ET. I have a question regarding the drugs. As mentioned by the professor, in order to become a formal member of ICH, it will take us 8 to 10 years. So for all the other drug approval, would it be a process shorter than 8 to 10 years? Because I'm unable to find a clear timetable from you. If it is taking shorter than 8 to 10 period, then for how long would that be? The professor also mentioned we would like to become FDA of the United States, but for the FDA, we have thousands or even tens of thousands of personnel. So how difficult is it for Hong Kong to set up a similar system? If our application to ICH is not approved, would it be very difficult for us to become a center of drug approval? Second, I have a question about a cross-border medical vehicle. This is a new measure to the general public. So which unit will be responsible for that in Hong Kong and also in China? Are we only targeting the patients who are moving from China to Hong Kong? If any emergencies happen on the ambulance, how are the patients going to be treated? Are they going to be sent to the public hospitals and not private hospitals? Sorry, you have already asked 2 questions. I have a question about eHealth Plus. Would there be any mandatory medical record that needs to be submitted? Well, I think I should only respond to 2 of your questions. First, about the approval and monitor of drug and medical devices. ICH is like an international platform. For instance, if we want to become an international sportsman and to compete with other athletes, the platform would be like the Olympic Games. On the other hand, if we want to conduct primary evaluation, it is not necessary for us to join ICH. Before we join ICH would require the regulatory body to offer data. They also required the medical devices companies within that city to meet their requirements. Because of that, we need to provide years of data. After primary evaluation, I think it will take us around 5 years to accumulate related data in order to file our application to ICH. Therefore, for sure, our primary evaluation will have to be completed years before we apply for ICH. We hope that we will be able to conduct primary evaluation as soon as possible. We have already taken the first step, that is the 1+ mechanism. The 1+ mechanism is a transition. It buys us time to enhance our capacity for evaluation, because the plus in this mechanism is very related to our primary evaluation. We have to strengthen our plus function, including our expert groups as well as our whole framework. We have to wait until all the conditions within our plus system are mature, then we can apply for the primary evaluation. By then, it will not be 1+. Before any accreditation organization approve, our expert groups will directly inspect all the data submitted to them. We hope that it will be as soon as possible, but it really depends. Just now you have mentioned FDA in the States. Many referred our initiative as FDA in Hong Kong, and I think it is inappropriate because For F in FDA, it refers to food, and for CMPR, we are not looking into food at all, and we are also setting up our own standards. As for the cross-border ambulance, we will refer it as the food train. A food train ambulance, because we already have a lot of food train ambulance services at the moment. If patients require such ambulance services, I believe that we will be able to offer them a direct transition in order to ensure their safety. The concept of this cross-border ambulance service is to offer point-to-point transport between hospitals. We hope that we will be able to look for corresponding hospitals for preliminary evaluation. We will look at the vehicles, the equipment on the vehicles, the medications they have, as well as the paramedics on the ambulance. We will have some pre-evaluation process. So we will look into the drugs, the medical devices, as well as the medical staff. We will consider the same conditions in both locations, but we will not just wait. If we are able to offer such services between certain hospital points or certain cities, we will roll it out first. Or if we are able to transport patients from China to Hong Kong or from Macau to Hong Kong, we will put it into practice first. We hope that in such process, we would be able to offer better healthcare services to the general public and to offer them a smoother passage as they need to cross the border. Such cross-border ambulance service is offered to patients that are hospitalized. Meanwhile, they are not in need of emergency services. Some might misunderstand the service because, let's say, if you encounter a traffic accident in mainland China, you will not be able to deploy the service because it is in contradiction to our principle. If it is some acute trauma, it is actually inappropriate for you to call for a cross-border ambulance services. For case of this time, for this service, we are looking for the stable cases in the China hospital. If they are suitable for such transfer, then we will kick off this point-to-point hospital ambulance services. As for the medical staff, the ambulance, and the drugs, we will evaluate all these items in advance to make sure that it meets our requirement. We have to make sure that these medical devices and medical staff can meet our requirement. Next, gentleman in the third row. Thank you. I'm from Singtao. I have questions about medical collaboration in the Greater Bay Area, including the medical voucher system for the elderly, and also the application of Hong Kong towards ICH, because cross-border medical data will be involved in all these measures. So what is the current process? It is only point-to-point. In the future, will HA recognize the medical report of these certified institutions? And also, as we procure medical services in the GBA, what kind of services are we talking about? If there are any mistakes in diagnosis, would there be a complaint mechanism?
Professor Low, regarding healthcare data, well, different jurisdictions have their own requirements. Through the support program for patients in Guangdong that was launched during COVID, under the program, healthcare records can be transferred across the border with the consent of the patient. eHealth Plus is an enhanced version. Patients can, using their mobile phone, bring the electronic healthcare record across the boundary. They can take their record to any place, not just the GBA, even places in other countries. Patients can have access to their records using the eHealth Plus. When it comes to procurement, we fully understand that quality is very important. We've had a lot of collaborations and cooperation during the epidemic. We have learned a lot from it. The support program I just mentioned, as well as the elderly healthcare voucher scheme, that they are all done through a procurement mode to enable Hong Kong patients to use services on the mainland. Well, from our experience, we learned that the service standard on the mainland is quite good. It gives us confidence. Well, data can be brought back using the mobile phone from the mainland to Hong Kong for follow-up services in Hong Kong, and that is very important. We will do it in a gradual manner. We'll start with low-risk cases, say for example the elderly healthcare voucher and pilot program of services by patients in Guangdong for general checks, x-rays. We will first consider services, say, the MRIs and CTs. We may consider expanding the coverage. Well, for the pilot program and the elderly healthcare voucher scheme, is used on the mainland at the price level set by our country. Each healthcare institution will have their own price level. We will set standards to control cost. We'll hear from Sammy in the fourth row.
The first question on cross-border collaboration. For the GBA Clinical Trial Institute, drugs of what types of disease could be first benefit and what types of biological samples could be exchanged across border, and how will you prevent the misuse of samples? And for the elderly healthcare voucher and procurement of services in GBA, how will you ensure the safety of the services and prevent medical records from being leaked? And second question for the 1+ mechanism, how much faster the approval will get and what are the clinical data requirements for the former companies? And in the long run, will the proposal of setting up a third medical school focusing on biomed research help speed up and raise the capacity of Hong Kong's own drug approval authority? And lastly, do you mind clarifying that how much of the 3 billion Jockey Club donation will be given to the government? Thank you.
With due respect, I think you've asked 5 questions, and the rule is that I can only answer 2. I'll follow the rule and to give the opportunity to other reporters here. The first about the cross-border collaboration in the our idea of setting up a Greater Bay Clinical Research Institute. Of course, in order to make the best use of the Greater Bay Area, both in terms of the patient volume and the efficiency and the standard of these clinical trials, we have to try to have connections and collaborations with multi-center studies, and we need to make the best use of the data as well as the clinical samples. So the whole idea of setting this up in the loop area is to ensure we can have these data and samples pooled in the area. Now, we need to get special measures in order to allow this because of but the whole idea is to pool all this into the loop area so that these data and samples will not be coming out. So your worry about misuse and leak will depend on the measures that we ensure. Then that is one of the reasons, why we want to put it in the loop area, to make sure that the data and the samples will be kept in the region and will not leak out. Second thing about the safety of the use of the facilities, we already have this pilot scheme for a long time, quite a while, and there is no evidence of any of this, including the use of our patients' electronic record through the point-to-point transmission from our eHealth office to the University of Hong Kong Shenzhen Hospital, and it's now time for us to expand this, and we will keep a very close eye on this and to ensure that we can protect our patients' safety. The quality of the care is good enough, and also that the clinical data will not be misused.
好，仲有一個提問。呢邊第三行最左嗰位女士，最右手邊。
The lady at the back. I'm from Hong Kong 01. I want to talk about primary evaluation. Just now you see you can only tell with the experience of 1+. Well, are there indicators, say 50 approval a year? Do you think you will be able to achieve one primary evaluation within this term of government? Secondly, manpower. You mandate graduates to work in public hospital. Is it going to be put at the back burner, or is it not going to start within this government? When it comes to enhancing manpower supply, we will definitely consider it. I won't use the term you used to describe it, that it will be put at the back burner. If it's not suitable now, it doesn't mean that it won't be suitable in the future. The most important thing is that we have policies and initiatives to help Hong Kong people. We consider different options. For certain discipline, they need to work in public hospital. I don't like the term mandatory. Say, for example, 1 year internship in public hospitals is not mandatory because the internship itself is very important to learning. If you're a medical student, you need practical training, and that 1 year internship is of great help to them. And there is also the specialist training. Assistance and support is given by experienced staff members in a public hospital, say for example those in the hospital authority and the various colleges and academies. They provide good quality training to student doctors so that they will learn what they need to practice independently in the future. So they don't just work in these hospitals to provide a service. They learn a lot and they accumulate experience in their internship so that they would be better equipped to practice in the future. Regarding the 1+ mechanism, I will defer to Dr. Lam. If we are to attain primary evaluation, we need to first take many steps. Well, we need various approvals, empirical studies, assessments, and preclinical trials. We need to have crude data on animal trials, clinical trials. So we need expertise from different disciplines. We also need to have experience. That's why we need to have the 1+ mechanism before we attain primary evaluation. We want to enable drugs for life-threatening and serious illnesses to come to Hong Kong, and we will learn through the process as to what expert we need, what good practices will have to be met by labs. We have to have everything in place before we can launch the primary evaluation. It takes time. Regarding 1+, well, currently the practice is to have two certificates from drug regulatory authorities. The process will be sped up under 1+, because if you need to obtain approval from 2 drug regulatory authorities, that involves more time, and they need to obtain approval from these 2 authorities from 2 different places before they come to Hong Kong. Under 1+, they only need approval from 1 authority. The plus is the additional local clinical data and an expert report. Let me give you an example. There is a rare disease. It's a certain Alagio syndrome. Patients are usually children. It's a hereditary condition. There is an accumulation of bile causing itchiness. There is a drug, Maralixac. It's a new drug. An application has been made to us. Let me use this as an example. They have obtained the first approval from the US and the second one from EU. It has taken them about 24 months before they make an application here in Hong Kong. If under the 1+ mechanism, they obtain the first approval from the US and then make an application in Hong Kong. If they have expert report and local clinical data, that is the plus. We reckon that it will only take 5 months to complete the approval. So there is a saving of 17 months for this drug to enter the Hong Kong market. That is the advantage of the 1+ mechanism. Important drugs don't have to wait for registration approval from 2 authorities before they make an application in Hong Kong.
Let me supplement about the drug evaluation system. It is the pharmaceutical companies who takes the initiative to research on drugs. Through clinical trials, they would acquire sufficient data, and then they will file for registration at the regulatory bodies in different countries. As we put in place this 1+ mechanism, it is up to the pharmaceutical companies for us to determine how many drugs application will we receive. It is not up to us to set a target of having 5 new drugs being approved under the 1+ mechanism. It is not up to us. On the other hand, Well, if you ask how much interest would a pharmaceutical companies have towards a certain country, it depends on the speed of the approval procedures and the speed of that. Second, are you able to optimize the equipments for clinical trials? Would they be able to conduct clinical trials in your location and to acquire sufficient data? So the issue is two-front. First of all, we have to improve our approval and registration system. Second, we need to offer them different equipments and multi-centers experiment locations for them in the Greater Bay Area. We believe that as we roll out the 1+ mechanism, we can expect that there will be more pharmaceutical companies considered to do their research in Hong Kong and to apply for registration. We believe that the number will increase more quickly after we have put in place the primary evaluation system. But it is not up to us to set the target. It's up to the pharmaceutical companies. As mentioned, our target is to roll out a system that is evidence-based. We are not just doing it for the sake of having primary evaluation, and it is not our target to sell more drugs. Our aim is to offer quality drugs in Hong Kong. Whether it is developed by the local team or the Chinese team or the overseas team, we will adopt the same standard for all of them. Because of that, we will not offer primary evaluation recklessly before we are ready. If we do not have sufficient experts, if we do not have such a capacity and procedures, rolling out primary evaluation will be disastrous to our medical system and the citizens. This is the end of the press conference today. Thank you.